Okay, well, I'll make a start and thank you everyone for joining us on our on the latest webinar series. This one is entitled Post-diagnostic Support, How Forward with Dementia and Dementia Australia Can Help. I'm Matt Paradise. I'm an old age psychiatrist and research fellow with the Memory Clinic Initiative, part of ADNET. And it should be very exciting to hear this talk today. I'll introduce the speakers in due course. So I'd like to start with acknowledgement of country. The Australian Dementia Network acknowledges the traditional custodians of country throughout Australia and their continuing connection to land, sea and community. We pay our respects to all Aboriginal and Torres Strait Islander peoples, their cultures, and to their elders past, present and emerging. So hopefully by now most people are aware of ADNET, but it stands for the Australian Dementia Network. I'll briefly mention it for those that are new to the webinar series, but it's a collaboration of dementia research experts and centres from around Australia, founded a few years ago on a large NHMRC grant. And it's got three main initiatives which work together: the ADNET Clinical Quality Registry, and it'll be the first time in Australia there is a dementia registry, the ADNET Memory Clinics, which this webinar is part of. And the idea is to establish a national memory clinic network to try and harmonise standards, and we're shortly releasing the guidelines. And finally, the ADNET trials, which is to try and establish and maintain a highly characterised trial-ready cohort of people at risk or people with MCI or dementia. And you can find out much more about these different initiatives on the website. If you aren't already, if your memory clinic would consider participating in the ADNET registry, please get in touch. And separate to this, you can also join our growing list of national memory clinics and specialist services, which is available to the public, GPs and so on. And you can see what it looks like here again on the website, which is a searchable map of networks around Australia, classified under different options. In terms of the webinar, so as a webinar, you'll be muted. If there are any technical difficulties, please use the raise hand button and one of our moderators will be in touch with you. And then there's a Q&A button. So the presenters will each present for 20 minutes and there'll be time at the end for Q&A. So please write your questions in that section. You can ask questions at the time, or you can do it in advance, and I'll keep a note of the questions for our presenters. And then at the end, there'll be a feedback survey, and filling this in will also give you a chance to get the certificate if you're needing this for CPD requirements, and I'll also give you an option for feedback. So today's speakers, we have Professor Lee-Fay, who's Professor in Aging and Health, NHMRC Boosting Dementia Research Leadership Development Fellow at the University of Sydney, and she conducts research that she hopes will make a difference in the world. Her main areas of expertise are in rehabilitation and post-diagnostic support for people with dementia, home and residential care for older people, the impact of COVID-19 on people with dementia, stigma, dementia literacy, and people from culturally and linguistically diverse backgrounds. She is particularly interested in developing and evaluating interventions to improve the quality of life of older people. She has methodological skills in population studies, systematic reviews, clustered randomized trials, instrument development and evaluation, as well as translation of research into practice. She has authored over 120 peer-reviewed articles and 3 books on dementia. She is an active advocate in improving how older people are treated and cared for. And then after this, we're going to hear from Emma Craig, who's Director of Client Services for Dementia Australia. Emma is the Director, Client Services with Dementia Australia, overseeing all services provided nationally for people living with dementia, their families and carers. She has over 30 years of experience in senior government, not-for-profit and private sector roles. With a Diploma of Health Science, over 10 years experience as a registered nurse, and a Bachelor of Business, she has both understanding and empathy for the challenges facing the sector. Emma has comprehensive knowledge of the complexities that exist in the Australian health, ageing and human services sector. She is passionate about improving the well-being of people living with dementia and their families through progressing systemic change and individual empowerment.
Thanks to ADNET Memory Clinics for the ability to talk to everyone here today. So good afternoon. I'm here to share, I guess, some of our work on post-diagnostic support and I guess how in Australia we can try and improve this together. So this is a problem that we've known for a little while now, that people with dementia and carers experience minimal support after a diagnosis of dementia. Here's a quote from our study. We walked out of the office thinking, what the hell happens now? We hear this kind of all the time. Based on the ADNET Memory Clinic data, we know that, which is a survey of 150 clinicians from 90 clinics, many of you, I think, who are here have participated in this survey. We know that 95% of those clinics offered some follow-up appointment after the initial diagnosis so people could answer questions, but only less than a third offered any type of cognitive intervention, psychoeducation or involvement of family members or input to rehab. Thank you to Sharon and the team for this data that's not published yet, which is from a second survey of memory clinics. Again, we asked more detailed questions about post-diagnostic supports, and you can see that while a majority of clinics provided at the bottom here care and family support and a care plan and some risk reduction education. Oh, got that some of these twice. Less than a third of clinics provided psychoeducation or speech pathology, occupational therapy, or OT, and even smaller percentage of clinics were able to provide multidisciplinary rehab or computerized cognitive training. We have a 5-country study led by Professor Henry Brodati. Australia is one of the sites, and in our surveys and focus groups and interviews in these 5 countries, all the people with dementia and carers from all the countries were saying that the post-diagnostic support was really not good. It was probably the best in the Netherlands, where they've got case managers for all people with dementia, and probably worst in Poland, where they're very minimal supports. So here are the results from our Australian surveys and focus groups. A caveat that it's a biased sample. We talked to people during COVID, so we were recruiting and talking to people online. So they were, highly digitally literate, well-educated, younger, English-speaking, and predominantly Caucasian. You'd think that if there were people who could get post-diagnostic support, these people are much more likely to be able to get it. And we also talked to health and social care practitioners. So from the surveys, we can see that 2/3 didn't get a care plan after diagnosis. So both the care partners and the people with dementia said this, and that most of them were not happy with the information they got after diagnosis. I'm not going to show all the results, but from our qualitative work, people with dementia with carers was telling us that it's a devastating diagnosis. I was shocked when I left, like numb. My thoughts weren't going anywhere other than absolute uncertainty. And certainly they told us that once they got given the diagnosis, they couldn't take in any other information, or some of them anyway, in that first interview. So there was a really strong emotional reaction from care partners and people with dementia. Here's a range of the feelings that they got. Each person was different. Most of the feelings were negative. So for some people, there was relief and explanation for the symptoms, and then they kind of felt lost. What do I do now? And the amount of information they wanted varied at diagnosis. Some people wanted to know everything, tell me what's going to happen so I can plan. And some people were like, oh, no, I just need to know like one next step. Or actually, I need to just go and think about it. I don't want to know anything else now. I guess no surprise that we found that post-diagnostic supports that they experienced were poor. I had absolutely nothing in terms of assistance from the medical profession. All except one person who I from memory was diagnosed at a Cadham's clinic in Melbourne, were not satisfied with their post-diagnostic support. And they told us about this disconnect between the diagnosis services, so the memory clinics or the specialists where they got diagnosed, and the post-diagnostic supports that were there. So for example, they talked very positively about Dementia Australia if they got to Dementia Australia. And Emma will tell you a bit more about their post-diagnostic services next. Specialists felt that GPs and practice nurses didn't have the right information and knowledge, and some health professionals who we talked to were even unaware of the supports and services that were out there. We found that there was a marked difference between what the clinicians told us they were doing to support people with dementia. So we were hearing all these wonderful stories about how they gave the diagnosis and what they did, and the experience of people with dementia and carers. And I guess the clinicians who talked to us are really interested in dementia, whereas I suspect that the experience of people in dementia and carers were more representative of what the majority of people with dementia and carers experienced. So we then tried to make a model, I guess, of what an ideal post-diagnostic support would look like. So it's got this kind of supportive center, this person or team. They wanted a person or team who gave them information support, information, navigation, and a plan, a one-stop shop, that was tailored to them, to where they were at, that was high quality, that gave them personalized referrals and local information. So local service information was really important. They also wanted health services, medical services. Some people with dementia and carers who had managed to get allied health were talking about wanting to get allied health services. And there was also, conversations around services relating to behavior, such as DB mass. A lot of carers in particular, but also people with dementia, talked about how emotional support was very important. So they talked about grief and loss counseling, but seeing a psychologist, about therapy for depression, anxiety, and acceptance as well. They wanted social support, both from formal support groups and from their family and friends. And there were lots of conversations about, how do we tell our family and friends, get them to support us? And those who had supportive family and friends, it made a big difference in helping them navigate the system and find services. They also needed help around decision-making and future planning, so financial, legal, retirement, end-of-life conversations. And they really had trouble navigating the aged care system and NDIS for the people with younger onset dementia. So they were interested in transport, cleaning, respite, shopping, care packages. And they also wanted information about lifestyle and living well, exercise, diet, activities, and clubs. We even wanted advice about, how to keep traveling. So our team looked at this and went, we don't have a big grant. How are we going to deliver this thing that people want? How do we do this? And I think we were really worried that we couldn't do this. And I think some of the people with dementia described it as like staring into this void. And I was like, we have this huge gap, this chasm between what people want, what they need, and what services there are. How do we cross this gap? And I was like, we can't just jump across this gap. This isn't going to work, right? So how do we build a bridge across this gap? How do we build this system that provides post-diagnostic support? And I was like, well, we just have to do it step by step, right? One stepping stone by one stepping stone. I've been thinking about these stepping stones as groups we need to influence. So our website has lots of information for people with dementia and their carers, a group that, one information, some of them do, not all of them do, some of the one information, maybe they can go out and it'll help them get the supports because there isn't a clear pathway to get those supports at the moment. We're here to talk to memory clinics because diagnosticians are a key part of signposting, directing people with dementia to supports, even if your services can't provide those post-diagnostic support, the majority of those post-diagnostic supports themselves. GPs and practice nurses, we understand that they're a core part of helping people with dementia manage their symptoms, and we'll need to do more outreach with them. We're not doing that as part of Forward Dementia very much yet. And also policymakers have been really happy to work with the dementia policy team and policymakers in New South Wales and hopefully otherwise to try and kind of think about how we make the system work in terms of post-diagnostic support. And allied health practitioners. So even though there are funding mechanisms to get rehab through allied health practitioners for people with dementia, it's often hard to find an OT who's skilled in looking after supporting someone with dementia, or a speech pathologist or a physio. So we also need to kind of build the skills and capabilities, I think, of allied health practitioners as part of this support. So our offering is a website, webinars, and resources to support clinicians to support their patients in the first 12 months after diagnosis. And it's called Forward with Dementia. If you Google Forward with Dementia or go to forwardwithdementia.org.au, you'll find our website. And it looks like this. There are 3 sections, a whole section of information written for people with dementia, kind of geared towards the first year after diagnosis, a section for carers, and a shorter section for healthcare practitioners. The material for people with dementia and carers is very practical. We've tried to use simple language without jargon to be positive, but have a realistic tone as well. And there's a strong emphasis on rehabilitation strategies and therapies and how to get post-diagnostic services. So to help people navigate the maze, even though we can't handhold them through it yet. There are resources for clinicians. So Henry Budati has just put out a short video on communicating the diagnosis. And we have this lovely checklist as well on, communicating a dementia diagnosis and things that should be considered in dementia care planning. There's resources to give your patients. You can print them out, or if you go to our website, you can order these and we'll post you a pad. So some take-home information for your patient. And we can even send you flyers or posters for your wedding. If you're interested in these, go to the website and we'll send you a sample pack for all these resources. So I'm asking you to help us solve this problem together, so have a look at our website. If you think that the resources would be useful, please share it with your patients. Share with your colleagues. Sign up for your newsletter, and as we make new materials, if there's something that you think that would be useful for you as a diagnostician to give to your patients, let us know, and we'll try and make this information. We keep producing more content for the website and resources as people giving us feedback. So always looking for improvements and topics and things that we can do to improve our website. So before I hand over to Emma, I guess, I have this vision of all our hands together kind of helping people across the gap. And as we build this, maybe the system won't change yet, but as we make it common practice that we refer more for post-diagnostic support, that we think about how we work together to cobble together the system of post-diagnostic support, that people will have a better experience. So I'm delighted to hand over to Emma Craig, who is going to tell us about Dementia Australia services, particularly around post-diagnostic support.
Thanks, Lee-Fay. I really appreciate your session, and certainly it really resonates with me around the increasing need that our population has as the diagnosis rates continue, but in particular also around larger diagnoses around MCI. This is a program that is very much needed and very much front of centre in terms of our offering. So I appreciate the opportunity, Matt and Jana, to present today. So I wanted to talk to you a little bit about our post-diagnostic support program. And some of you will be aware I came and spoke at one of your sessions earlier in the year. And now we've had an opportunity to have a year of delivery over the year and to have a look at how the program's being accepted, how the program is being met with clients, and the work that we can do to look at improving and increasing availability. So some of you who may be attending today might not be aware of all of the work that we do at Dementia Australia, which is quite varied. So as an organisation, we do exist to empower and support an estimated 500,000 Australians living with dementia and almost 1.6 million people involved in their care. As many of you might be aware, we are the peak body for people who are impacted by dementia. We are also a source of trusted information, education and support. So we will always advocate for positive change for both the person living with dementia, their family and the carers, and support vital research in this region. So we are definitely here to support people individually and both collectively as a group. I head up the client services support team, and we have approximately about 300 staff, and our particular target audience of support is the person living with dementia, family and carers. So we identified some months ago a significant gap in the post-diagnostic space, as Lee-Fay said, and many of the outputs of her research really resonated with us in Australia. Our model of post-diagnostic support was based on the Alzheimer's Scotland model and the 5-pillar model that they have. So our program provides time-limited, tailored, one-to-one information for support for someone who's either recently been diagnosed or for someone who is living with MCI, their carers and families. And the other important part of this is it's through a single point of contact. So what we did find, many of people, you maybe were familiar with the Key Worker program back in the day prior to the NDIS. The connection there was that that individual point of contact was really important for someone to feel like they had one person to go to and didn't have to confuse matters and go to multiple people. So our approach that we take at DA is every person with dementia is different. Their experience is unique. Our program is person-centred, and it looks at an individual's culture, their location and their social situation, and they're all respected on the basis of how we are engaging with them. The services are tailored, so no two services might be covering off exactly the same issues, but we are working with the person as at the centre of the goals. We work with the individual to really understand where they're at, where are they at within their journey, identify what their goals are, work with them to understand what we might be able to support them with. And as Lee-Fay said, some people are wanting to get access to the NDIS, some people are wanting supports in other areas. So we can tailor the program to an individual's needs and what their needs are at that time. So we also have an offering of all our other range of supports and services, which are available for individuals. And we also work with the individual if they would like to develop an individual support plan. So they can take that with them and have a look at developing and continuing to manage that and live through that through after their support has ended. The whole program looks at practical support and providing all of those pillars that Lee-Fay talked about before, the emotional, the practical, the networking and linkages, they're all key, and then the information and education part. So a person with living with dementia and their carer is able to increase their understanding of dementia and what particular type of disease they have. They are able to navigate and plan supports and establish a support network. We work on an enablement model. So we build their capacity, both the person with dementia and the carer. And from the perspective of DA, it's really important that that can be, you know, a dyad relationship, or it can be the one-on-one. And it's not just the person, it's the whole network around them that's important to build their capacity. So we help them to engage and navigate the many systems that we're all of us are familiar with. We often have clients and carers who are navigating and straddling all three systems of the NDIS, My Aged Care and Carer Gateway. And if you're someone working within the sector, you may be quite familiar about how to do that, but often that's not the case. and we help people plan and prepare for those key transition points. So the next few slides is really talking about who's been using our program and what we are finding in our first year of delivery. So overall, over the last financial year, we had a look at the interest in our program, and it was slow to start to build up awareness of that program, but now we have a high level of demand. And what we found was that there were about 42% of people were the person living with dementia who was engaging with this program. 46% of the participants in this program were the primary carer, but we also had opportunities and situations where we would have a family or a friend or someone that was just concerned about their memory. And we certainly have hoping to increase those other areas where people are concerned about their memory and come to us earlier so we can support them to connect with diagnosticians in the future. We found in relation to, demographically who was participating, we found we had quite a large metro split, but we are seeing an increase towards our regional and remote. There are some people that obviously don't necessarily nominate whether they're from metro or regional, and we obviously have to factor in that if they want to remain anonymous. We also found that we probably have about 9% of younger onset clients that have engaged with the program, and a small amount of culturally and linguistically diverse clients who are engaging. We're looking to increase our numbers and acceptability with those communities. So how do you refer to our program? So you can contact our Dementia Helpline, which is 1800 100 500. We have a form on the website, and that one is listed there on the right-hand side of the slide. Or you may have an established relationship with Dementia Australia, and you can contact one of our officers. What we have found in terms of who is referring to the program, the highest line refers to people that have been involved with other services within Dementia Australia and then are referred on to engage with another program. We're also getting increasing referrals from Helpline. We also have had a range of other self-referrals and also memory clinics coming to us for a whole range of referrals to this service. So what we have been seeing in the program is a large percent, and this could be COVID impacted as well, as many states have been in lockdown. 49% of people have participated in these sessions over the phone. 32% have participated in a video conferencing capacity, and about 17% have participated face-to-face in one of our DA offices. And I would expect, we try to work primarily at the preference of what a client wants and what's going to work for them, because obviously there may be some challenges with online or connectivity issues, and absolutely we're really focused on delivering what the best outcome is for a client. So the time spent in the program has varied, and we have been quite fluid with allowing people to come in and out as they see fit, but also if they needed more frequent support in a short-term focus, we were happy to do that. So essentially we're seeing on average that 3 to 6 months is the highest percentage of what someone engages with us. Some of the program participants have lasted as long as 9 months, and obviously a few at the beginning started off at 0 to 3 months, but around 3 to 6 months is really seem to be the sweet spot for where people are wanting to participate. So we have conducted an external evaluation on the PDS program, and that was really with the intent of looking at how can we iteratively make improvements to the program, look at the acceptability and making sure that we can make sure that it's actually meaningful for people that are engaged. So clearly, there's a lot of objectives around the information, education, linkages, and improving health outcomes in that space and health literacy. So in terms of satisfaction, you can see from the slide there, we had 95% people said that they were highly satisfied. And in terms of when they contacted Dementia Australia, they felt like they were heard. They felt like they would come back to us, and they understood that the information and support was helpful. And they also said they understood the particular needs. And that's just one quote below around what someone has advised us around their experience and their engagement with the program. So in terms of the information and education outcomes, you know, we have a very strong focus about improving health literacy and health outcomes. And I think, you know, we all play a role in doing that. You know, when I heard Lee-Fay talk to, all I heard was the diagnosis, and that's a very familiar thing that we hear at Dementia Australia. After that, all the other information might dissipate and be kind of just this area where people can't take in the information. So post-diagnostic supports is extremely important, so that lots of the areas that have been advised by a diagnostician can be reinforced in terms of their understanding of dementia, and also knowing how to reach out for supports. Also, we really have a strong focus on providing practical strategies that people can go away and implement themselves, and then come back and seek if they have questions. So the important thing for us is making sure that people have the strategies to cope with their situation, but also about how to manage a future issue should it arise. And that's all I have for you today. So thank you for your time today. I appreciate that, and hope that was something of interest to you or your clients.
Thank you so much for both talking about such an important area, but I guess historically one that hasn't always been prioritised. So it's great that it's now starting to get the attention it clearly deserves. We've had a few questions come through on the Q&A, but there's plenty of time for discussion. So please, if you have any questions for either participant, please just write it in the Q&A box. I had one question for Lee-Fay. I don't know, has any work been done speaking to clinicians or diagnosticians to ask possibly why we aren't doing post-diagnostic support so well? I mean, I guess you'd probably get a vast response, but is it time or confidence, or they just think it's someone else's job, or have you got any inclination?
Well, we know from the ADNET memory clinics Delphi process that some memory clinics at least aren't funded to provide post-diagnostic support. Their role is diagnosis, CADM's notably, I think. Yeah. So they're like, well, we have to refer back to the GP. The challenge then being the GP doesn't know that they're meant to be providing post-diagnostic support, and they're not very good at it. So that's a big gap, I think. We've also heard from some GPs, but also other clinicians, that it wasn't their role to do psychosocial support, that they saw their role as providing medical care, but that the social, one GP called it the social work aspects of dementia, that it wasn't their role to do that. And while Dementia Australia do a nice job of providing some of that help, if they don't ever make it to Dementia Australia, they're never going to get that help. And I think the other thing is that we also heard from people, from both people with dementia and the dementia advisors, for example, that people say they're not ready for the service. So it's quite a big step in terms of self-identity to identify as having dementia and ring Dementia Australia. And we know that even outreach services that ring people and say, would you like to come to a webinar? Would you like us to come and visit you? People will say, no, we're fine now. And so, you know, I guess it's both ways, that sometimes we do have some services, but people don't want them because they don't want to self-identify as having dementia, which I know sounds weird because they've just been given the diagnosis, but there's still a lot of denial happening.
Okay, thank you. Emma, well, I'll take the the privilege of being the chair to ask the first question for you. But I'm just wondering if you could flesh out a bit more about the support program. So obviously I understand it's great and it's very person-centered, and it's certainly not a concrete one stage fits all. But for example, you were talking about helping people navigate through some NDS and some of the complex systems. Is it more individual support for the patient with dementia and their carer, or can you actually help them with the paperwork themselves? And I guess my other question is, although most people come through for those 3 to 6 months, how many sessions would they have on average in that time?
Yeah, thanks, Matt. In answer to one of your questions there, we are offering 6 sessions over the 6 to 12 month period that we're able to deliver with an individual. And, you know, the timing of and the distance between them is really about what an individual's needs are and where they're at. In terms of the content, we found when we had you know, we have a structured program of what we're going to deliver in each session, but it really is important to, you know, from our perspective, to really look at where the individual's at. So they may already have, you know, an NDIS, access to the NDIS. And from our perspective, there are, you know, might be 27,000 people living with younger onset, and only very few people have access to the NDIS, and many have tried to get access a couple of times. So we also are able to work with people to individually tailor and help them meet those access requirements. So we're able to work with them and their healthcare professionals around supporting them to gain access to the NDIS. So we certainly have a whole range of particular scheduled sessions, but it really is about tailoring individually. So we'll go into a lot of the disease process, where it impacts, why they're noticing certain things about communication or other particular areas, you know, what the you know, the biology of everything is, and to understand about the impacts of the disease and what's to expect. We also go through that forward planning, that whole space around managing, you know, your affairs, forward planning, and making sure you have things in place for the family and friends, but also breaking it down to discussions that you might have with how to have a conversation around your diagnosis, and also how to talk to friends or family, or how to talk to family members about your diagnosis, and be able to identify how they might be able to reach out and get support. So there's a whole range of quite tailored information, but what we have found is that that we didn't want it to be, you know, week 1 we're delivering this session. Yeah. It really is about understanding where they are and developing that. And the idea of having that individual support plan means they can take that away and actually implement it in their own life.
Fantastic. Okay, well, thank you. Well, we'll get to the Q&As now. I've noticed there's quite a few questions that have come up in the chat window as well, which is a separate window from the Q&A. So I'll try and get to those questions as well. But if I haven't, you could always try and copy and paste them over to the Q&A, but I'll try and attend to everything. So Henry Brodati has also just made a comment about the Forward with Dementia website and its correct address. But I know, Lee-Fay, you've also posted a link to that in the chat comments, and you can just search for Forward Dementia. So first question, when and from where will people need or want advanced care directives, or advanced care planning, including AC directives?
Well, I mean, people want it. Some people want to do it straight away, and some people don't want to think about it. I don't know if Emma's got suggestions on how, like, where people can get help if they want help to do it.
Yeah, because there's obviously the state legislative requirements in, you know, and so each state has a different requirements in that space. We recommend that people reach out and talk to either their family lawyer or talk to OPAN or a whole range of other organisations that can help people within that scenario as soon as possible, really. It's not so much about it's about just having the information, and information is power, really. Putting in place what is necessary, and we recommend, I mean, there's not really a good time to be talking about those items. I think it's just a difficult conversation that people need to have, and as if you're prepared early, it really does set you up in a way that's much easier to manage.
Is that, Lee-Fay, is it one of the kind of on the checklist or advice for clinicians in the Forward with Dementia? Yeah, okay.
Yeah, it's a thing to cover, but the clinicians can't, diagnostic clinicians, anyone, usually aren't able to support the person to actually do that paperwork. And I think we've identified that kind of higher order specialist social work is a gap in post-diagnostic services as well. Yeah.
Okay. There was a question: how does this website, I guess Forward with Dementia, differ from Dementia Australia website? Is Forward with Australia more for GPs, health services? And I guess there's been a few questions, and just conceptually, about how the two services and programs kind of integrate with one another. So maybe if you could both.
Yeah, I'll take that. So Dementia Australia have a great website with lots of useful resources as well. Forward with Dementia is supplementary to that, and it's focused in just the first year after diagnosis. Because we had the luxury of writing it all at once, it has I guess a structure that perhaps Dementia Australia's resources don't. We've really worked on the language and being practical, and because we could co-design the content with people with dementia and carers and clinicians, I think we've included lots of practical kind of tips and strategies. So it's a supplement to Dementia Australia's website, and we hope that Dementia Australia will take it over, when we're finished doing the research, but that agreement isn't in place. So
yeah, it's certainly something that I think that we see, just to add on from what Lee-Fay said, it really is about working together. And I think, Dementia in Australia and internationally is about working together and being a networked organisation and working with one another. And it's not really just a place for one organisation. There is so much need that we need to think about things differently and work in partnerships in lots of cases.
Thank you. You've partly addressed this, Emma, but there was a question about your role in people with younger onset dementias and assistance for clients to access NDIS. I believe Dementia Australia is no longer an NDIS provider, but what role, if any, does it play?
Yeah, sorry. Yeah, so we are, it's the beauty of COVID behind me, I'm sorry. So we are, correct, the person that's asked is obviously we have been transitioning out of the NDIS. However, our role we see with working with younger onset is our focus is very specialised, and we want to be able to focus on the areas where we can add the greatest amount of impact. So we have a whole range of services. Post-diagnostic support is one. We will continue to support younger onset clients with a whole range of other services, including counselling, education, one-on-one services, and a whole range of other things. We have just decided that doing that support through the NDIS is not the way Dementia Australia wants to progress.
Okay, thank you. Question from Michael Woodward. Do you think it's enough after spending 30 minutes with them to just refer them to both the website and to Dementia Australia and hope all the various issues which are clearly important but poorly addressed are covered?
No, it's not enough, Michael, but it's better than nothing, which is what some people get now. I mean, certainly we need a lot more than that. And if we either need funding for specialist services to provide more specialists, more post-diagnostic support, or we need GPs to be much more skilled in providing post-diagnostic support, and then we need a system that connects Dementia Australia services, GP services, aged care services, allied health services in a much better way. This is like step one, I guess, of that massive gap that I talked about. And we haven't talked about MCI, and the website does not cater for MCI. We know it's a problem, and yes, I would like someone to give us some money to work on that also.
Thank you. And I guess just to emphasize, the importance of this is not only in the practical strategies, but it's just also raising awareness in the conversation and just getting it out there to all the stakeholders involved.
Yeah, and I think that, we're hoping that people with dementia and carers will come to the website and they'll go, hey, you could get this thing. Like, we could go to Dementia Australia and they give us this thing. It's not just a phone number to ring. And maybe if I go to the doctor and I ask for, about brain training strategies, I could get some help there. And if I look at my lifestyle, might be able to slow progression of my dementia.
Someone asked about getting support to solve problems with BPSD, so behavioural and psychological symptoms of dementia. Andrew Plusman answered Dementia Support Australia, who do have a range of services, DBMAS and Severe Behaviour Response Team. I mean, I'm biased as well, but I would say, that's a role for older persons mental health services as well. Yeah, I don't know if either of you wanted to speak to that, about how patients maybe with more mild BPSD could be incorporated or helped by the programs.
Yeah, I certainly would agree that, we have to make the necessary referrals to SBRT and DSA around, getting those particular strategies, and certainly, as you said, Matt, around the older person's mental health. So we see our role as working cohesively in referring people as necessary to whatever services are nationally, and we see there's real opportunity to still engage and provide those other supports, but obviously when someone has those specialty needs, we need to refer on.
Yeah, okay. And I guess linked to that, it's always a conversation about supports in regional Australia. Emma, you were saying, or you've done some surveys showing what proportion of people are from regional areas. Yeah,
we certainly, if you're looking overall, it was actually interesting just to look at our post-diagnostic supports. And, I will say that was the first year of delivery. So I'm hoping that we're certainly getting much more increase engagement with the program. If you look at our overall supports across the person living with dementia and the family and carers, we have a much higher rate for regional and remote services overall. So we do have a range of offices around the country. We do have in Victoria, as many people would know, we have a range of locations and supports in other regions. So our view is it's certainly about supporting people no matter where they are and what time frame they're in. But yeah, certainly we are looking at making sure the supports are both acceptable and appropriate for people in regional and remote regions.
I think in terms of the system, it's harder to get a specialist diagnosis in many regions. It's harder to get a GP in some regions. And certainly in terms of any allied health or those other kind of supports, it's more difficult. And I think that is an issue, an equity issue that is not solved yet, Matt.
Yeah, I guess it's also one of the challenges and opportunities post-COVID is also just different ways of working, but also, facilitating remote work. Emma, could you provide some more info on goal setting and attainment? Also, what would be the most common areas? I guess they want some more specifics about that aspect of the program.
So it's really about the individual, as I said before. It is really about understanding what are the goals that they want to achieve, and it can be it might be to participate in a future event. It may be around obviously accessing things such as the NDIS, or it may be about being able to work through a range of issues to get to a particular endpoint. And then maybe around communication issues and a couple of other areas. So we haven't really, it isn't a one size fits all. It really is about working with that individual, understanding what it is and what steps can we put in place to work in a kind of enabling way and a strength-based approach to working with an individual.
Okay. I'm just looking through some of the questions here because we've only got a few minutes left. One of the participants asked a question about, is there a registry for post-diagnostic support programs? And Inga, who's the program manager for ADNET memory clinics, has responded to that. But that's something certainly that in the ADNET memory clinics we'll be looking to expand. At the MAP, it's mainly, if I'm correct, diagnostic services at the moment, but some of these other services will be coming online in due course, and that's really an important area.
I agree, Matt. And I mean, not everyone gets diagnosed through a memory clinic. I think most people don't get diagnosed by memory clinics. So I think that the issue, that equity issue around who, you know, if memory clinics deliver post-diagnostic support, then all the people who don't get diagnosed by the memory clinic, can they still get those supports? So I think being able to find post-diagnostic supports in your area is really important. And it was something that people wanted, a map of local supports. I will plug that the PHNs are getting funding to write local dementia pathways. And so if you run a post-diagnostic service, you should get in touch with your PHN and make sure that you get on their local pathway.
It's certainly an area that we've been talking to the government about in terms of how do we really ensure people are getting referrals to the necessary supports. And, you know, I absolutely understand the need to stay connected with either the diagnostician or the GP, but it's about, triangulating to that other specialist provider in that space. That it really does show to improve health outcomes. It really is about collaboration in that space. And it's certainly something, you know, we've been talking to the government about the PHN initiative, but also trying to make sure that people from my aged care that identify as having dementia as an issue or a carer of someone, that those referrals will come through to Dementia Australia, so that the best point of opportunity. We also will be doing an outreach program where we will be aiming for diagnosticians to connect with us, and we'll be strongly encouraging that they connect with us so that soon after someone is diagnosed, we can outreach over the phone to connect with them to provide that support. Because as Lee-Fay said before, people can't take in all the information after that appointment. It really is about providing that information in a way that's meaningful and values driven.
Fantastic. Well, I think we'll probably have to end the questions there. I'm sorry we didn't get a chance to address all of them. Lee-Fay and Emma, any final points you want to make just in conclusion? No, you don't need to.
No, I was just going to say, you know, we know that post-diagnostic support is a problem, and I think that these are small steps to working together to fix the problem. Yeah.
Yeah, thank you for the opportunity, and certainly please reach out to Dementia Australia should we be able to support some of your clients.
Fantastic. Okay, well, thank you both again for such a fantastic and important presentation. I'll just finish with some concluding remarks. So, as I mentioned before, when your window closes down, you'll get an option to do a survey, which is important for us to give us feedback on what you felt about this and also ideas for future webinars. And you can also get a certificate for CPD purposes. Our next webinar is the end of the year update, which will be great because we'll have talks by the 3 initiative leads. So Chris Rowe, Sharon Naismith and Stephanie Ward talking about those 3 arms of the programme, which will be on the 9th of December. And we'll be sending out an invitation and a flyer in due course. And also I'm excited to announce we'll have the first of a ADNET Memory Virtual Grand Round series. So we've been thinking about and planning this for a while, and the idea is that it takes the best aspects of a traditional hospital Grand Round and really expands it over the ADNET Memory Clinic network, so that it's a chance for clinicians all around the country to share complex cases, interesting, informative cases, to have a kind of more discussion friendly environment, but also a chance for various centres and clinicians to network and to understand what other people are doing around the country. So that should be fantastic, and it'll be presented by Simon Lewis, who many of you know from previous presentations, and he did a previous great webinar. He's a good, excellent presenter. So that'll be on the 18th of November, so shortly, just in a few weeks. And again, we'll send round more information nearer the time. Again, there's the contact email address for the ADNET Memory Clinic team. So please get in contact with us if you're running a memory clinic service or if you just want to know more information about what we do. So many thanks to our presenters once again, and hopefully I will see you next time, both for the virtual ground round and for the final end of the year webinar.